Hello, my name is Thao and I'm from California State University, class of 2023. In this video, I will be talking about niacin. How should you take this medication? It's important that you always take this medication with food to minimize stomach upset. This medication can commonly cause flushing and heat sensation in the face and cheeks area. Although there are non-flushing formulations on the market, you can avoid the flushing by pre-medicating 30 minutes before taking the medication with aspirin or other NSAIDs. You should also avoid alcohol, spicy food, or liquid while taking niacin, as it may worsen the flushing. The extended release formulation or niaspan can be taken at bedtime after a low-fat snack. Long-acting formulation should not be crushed, broken, or chewed, and controlled release formulation, such as low niacin, may be broken along the scored line. Niacin is a vitamin B3 that is available on the market in different formulations such as regular release or Niacor, sustained release or slow niacin, and extended release niaspan. Even though it moderately increases HDL and lowers LDL, it may benefit patients on statins with elevated triglycerides. However, efficacy hasn't been established, and currently there's no recommendation for its use in treating dyslipidemia. Is available in various strengths and formulations, and niacin 500 milligrams is widely available for purchase over the counter. There are pros and cons to taking niacin products. Some advantages to taking niacin is that it is cheap and is easily accessible over the counter. Its controlled release formulation is advertised as non-flushing, which may be beneficial to some patients. However, some disadvantages to taking this medication is that the flushing may be bothersome and very prominent in some patients. It also comes with many adverse effects and contraindications. Its efficacy is not fully established, and there is only a moderate reduction in serum LDL. So how does niacin work in the body? It is converted to nicotinamide and then to nicotinamide adenine dinucleotide, or NAD+, and the hydride equivalent, which is NADH. And from there, it lowers triglyceride levels by inhibiting lipolysis with a decrease in fatty acids in plasma and decreased hepatic esterification of triglyceride. It raises serum HDL by reducing its catabolism and selectively decrease hepatic removal of HDL, ApoAI, but not the removal of cholesterol esters. And in addition, it reduces hepatic synthesis of VLDL, or very low density lipid, which leads to the reduction in the synthesis of LDL. However, its effect is very modest compared to statin. For this lipidemia, patient can be started on 250 milligrams regular release formulation or Niacor, and then titrate every 47 days until therapeutic. Maximum dose for Niacor is 6 grams daily in 3 divided doses. The sustained release formulation or slow niacin can be started at 250 to 750 in the morning or evening or as directed. The extended release formulation or niaspan needs to be started at 500 milligrams at bedtime for 2 weeks, then 1 gram at bedtime for another 4 weeks, and then adjust dose based on response and tolerance every 4 weeks by no more than 500 milligrams increments to a maximum daily of 2 grams per day. Niacin can be used as a dietary supplement over the counter or can be used to treat pellagra off-label. For dietary supplement, patient can be instructed to look for niacin or vitamin B3 over the counter and take 50 milligram twice daily or 100 to 250 milligram once daily. However, the 500 milligrams dose is more commonly sold than the 50 to 250 milligrams formulations. For pellagra, a patient can take 50 to 100 milligrams of the regular release formulation 34 times daily to a maximum of 500 milligrams daily. Patients with renal impairment should use this medication with caution. However, for patients with hepatic impairment, it is contraindicated to use niacin when they have significant or unexplained hepatic dysfunction, active liver disease, or unexplained persistent transaminase elevations. Patients who are on niacin therapy should be warned with the following warnings. Um, They may commonly experience flushing and pruritus. Patients should be advised to take the medication with food, divide the dose into 2 to 3 doses, and discontinue if severe cutaneous symptoms occur during therapy. Um, GI distress, vomiting, diarrhea may occur as the patient take this medication. Therefore, it's important to take the medication with food. However, its use is contraindicated in patients with peptic ulcer disease. Hematologic effect may happen where the patient's platelet count may reduce, whereas the prothrombin time may increase. Hepatotoxicity and hypophosphatemia may increase as well. Use should be cautioned in patients with cardiovascular disease, diabetes, and gout. Therefore, close monitoring or discontinuation of therapy may be warranted in these patients. Patients with hepatic impairment and renal impairment should use this medication with caution, especially those with hepatic impairment, where in some cases this medication may be contraindicated. Patients who have hypersensitivity to niacin or any of its component is contraindicated to use this medication. Those with active hepatic disease or significant or unexplained persistent elevations in hepatic transaminases are also contraindicated. And finally, those who have arterial hemorrhage or active peptic ulcer disease are contraindicated to use this medication. Here's a look at some of the adverse reactions that may occur in patients taking niacin. Flushing and GI upset are very common, and patients should be counseled to eat before taking the medication. Patient may experience skin rash and dry skin as well. Diabetic patients should be advised to monitor glucose as decreased glucose tolerance may occur. Patients should be advised to let their healthcare provider know if they experience any muscle weakness, changes in vision, or as well as any signs and symptoms of trouble breathing. And that concludes my presentation. And here's a look at all the references. And thank you for tuning in.